Hey everybody, Adam here. You know those people who no matter what they decide to do, what they set their mind to, everything just always works out for them? Yeah, I'm definitely not one of those people, alright? It's almost like I'm cursed. So I've mentioned this in my previous videos that I was going to have another surgery in July. It was on July 2nd, this past Monday, that I had my second revision after my periareolar top surgery that I had last year in June. So, just a little bit of timeline. I had my surgery in June last year, then my first revision in late January this year, and now my second revision, 2nd of July. So, again, the way it was explained to me was that this was a small procedure, outpatient, local anesthesia. You come in, you go home, it's no big deal, right? Based on my experience from my previous surgery from January, this time I was a little more cautious. I had planned for a little longer recovery period just in case, but still I did not expect things to go so sideways. Surgery went fine, I mean, to what I can tell, right? I was just lying there. Nothing in particular that I could notice. They discharged me, sent me home. A friend of mine brought me home. Thanks again for that. And just as I came in, I started taking off my clothes to put on something, more comfortable to lounge around the house in. And I noticed there's this lump on the right side of my chest. I will post a picture just to show you. But the lump was the size of a tennis ball. All right, so that freaked me out. I called my doctor's office, they told me he was operating, so I explained what my situation was, and they kind of patched me through to him. I explained the situation to him, and he's like, oh no, that's not good, come back. Alright. My ride had just left, but okay, I called the cab, I went back to the hospital. And so, healthcare professionals have kind of seen it all, right? So you don't expect them to be shocked by much, at least I didn't. But when I opened my binder and they took off the bloody bandages, the nurses went like, ugh. Alright, so, that's a clear indicator something's clearly not right. So the doctor comes in, looks at my chest, he's like, okay, that's a hematoma. So basically blood buildup inside, under the skin. That needs to be drained. Okay, yeah, sure. The nurse hands him like a big ass needle, he's like, no, I'll just use this. And if you have a delicate stomach or are not good with gore, just click off, you do not want to hear this. The rest of you, welcome to my life. He takes this tweezer-like thing. I don't know what it's called exactly in medical jargon, but it looks like a tweezer, but it has like this really narrow, long tip, right? So he takes that thing, it's sterile, he took it out of like a sterile wrapping, so he takes that, jams it kind of between my stitches or through my stitches, I'm not exactly sure, kind of the stitches he made around the areolas, pushes that in, and then just the blood starts pouring out. Luckily for me, either I was still in shock or the anesthesia was still working, I'm not sure which, but I didn't feel that, it didn't hurt. It looked scary, I felt the blood pouring down the side. Also, I was still kind of half wearing my binder because they didn't take it out, they just opened it, and so I was lying on it, and when the blood started gushing, I was kind of going all over the binder, whatever. And that was the only binder that I had. That's the only one they gave me after my initial surgery, so, okay. So yeah, he tried then to kind of facilitate the evacuation of the blood kind of by pressing on my chest, to kind of push it out like you would push air out of an air mattress. But still not all of it will come out. So he then took the tweezers again and put them back in, and somehow, I don't know, don't ask me how, he pulled out this thing that seemed to be like this half-clotted blood. It was kind of sticking together, it wasn't completely hard yet. So he pulls that thing out, it's kind of this big from what I saw, it looked huge. Pulls that thing out, and that really just kind of then made way for the rest of the blood just to drain out. After that, they put a drain in, like a straw-looking thing, and just kind of bandaged me up and put they didn't put my binder back on because it was all bloody, so they took it off. They washed me a little bit here from the blood, and then they just put like these elastic bandages around me. And then they asked me to stay for observation because clearly they were worried that this would happen again. And me being curious like I am, I asked one of the nurses if this was something common. Was this something they encountered a lot in people with my type of surgery? And, or is it just my luck? And she actually said it must be your luck. So this is not something that happens to everybody, okay? It happens to me. So yeah, I spent 2 days in the hospital. I was kept there for observation. I was given antibiotics just in case, because from what they explained to me, these things tend to get infected, plus hospitals are really, a great source of infection. If you don't already have one coming in, you might leave with one. So I guess as a precaution they gave me antibiotics and discharged me after 2 days because there wasn't much output anymore from the wound. Nothing was coming out. I was told to get my dressings changed every 2 days, so on Friday I went to my GP, who was incidentally ill that day. So I was passed on to another doctor who, upon seeing my chest, said the following: I mean, sure, it looks horrible now, at which I had to laugh and crack a joke about how this was the beach body I was going for. But honestly, I will put some pictures here. I took some I wanted to see what it looked, because it's very difficult to see from, from this perspective. So, because the nurse undid my bandages and then left me there to wait for the doctor. So I was lying there, I had a minute, so I took a couple of pictures to be able to better see, like from the front and the side, what it actually is that I'm working with. So it looks pretty bad, okay? It looks like I had been beaten severely with like a baton or something. It looks really black, and it's quite swollen, and luckily for me, I'm not in pain, okay? It doesn't hurt. I took some painkillers while I was still in the hospital, but none since I'd come home. I'm uncomfortable again because the binder and the restrictions, like I'm not allowed to move, not to use my arms too much. Hello T-Rex arms. But I'm luckily not in pain. What is really irksome to me is that, there's guys who have had their surgeries, they go in, they come home, they take their time to recover, and they're done. And this is my 3rd time going back, and yet every time, I listen to the doctors, I follow the instructions, I rest, I don't exert myself, I don't do any of these things, and it just keeps getting worse. And it's infuriating. I literally didn't even have time to mess this one up. I mean, I just had arrived home from the hospital and it was already all wrong, right? So I didn't do this to myself. And even the nurses said that this is not something that happens to everybody. So, a part of me is thinking, just to clarify, I would never go back on having top surgery. I would have done this no matter what the case. Top surgery is one of the best things that happened to me in a long time. Okay, it has allowed me a freedom that I hadn't had before. However, there are different types of top surgeries, and thinking back now, yes, okay, initially the goal was to have as little scarring as possible. Okay, so Perry seemed like the perfect thing. When the doctor said I would actually qualify for it, I was happy because in the long run I wouldn't have scars all across my chest. But, thinking back now, statistically, double incision has a much lower rate of needing revisions. Yes, some people get dog ears, but a lot of people don't need revisions at all, whereas Perry has a much higher rate of revisions. I'm almost thinking, should I have gone for double incision? Yes, I would have had scars, but I would have been done with this by now. I'm so tired of doing this over and over again. I want this to be over with. I want to just live my life and not focus all this energy and all this thought in this one thing, this one surgery that just won't go away, right? So again, I wouldn't not get top surgery if I had known it was going to be this difficult. However, I just really wish this was it. Okay, my chest is still very swollen, but the way when the doctor explained it to me, the hematoma would reabsorb or something, it would dissolve and just the swelling would go away. I don't know in what time frame this would happen. He said it could be weeks or months, but I want this to be done. I want this to be it, okay? Sorry for, this downer kind of ending, but I'm just a little tired from this whole thing. So I hope everybody's having a better time, more luck with their projects than I am, and yeah, take care.